Normal jaundice. An abnormal jaundice of newborn babies. What is jaundice? Jaundice in babies is a condition where the skin and eyes appear yellow due to a buildup of a pigment called bilirubin in the blood. It is common in newborns because their livers are not yet mature enough to process bilirubin efficiently, and most cases are temporary and resolve on their own. However, it is important to monitor, as high levels can be a sign of a more serious issue and require treatment. What are the two types of jaundice in newborns? The two main types of newborn jaundice are physiological jaundice, which is normal and harmless, and pathological jaundice, which is more severe and caused by an underlying disorder. Both result from high levels of bilirubin. But physiological jaundice is temporary, while pathological jaundice requires treatment for the underlying cause. Let's discuss them in details. First, we will discuss physiological jaundice. This is the most common and usually harmless type of newborn jaundice, affecting about 6 out of 10 babies. It occurs because a newborn's liver is still developing and cannot process bilirubin fast enough, which is produced from the breakdown of fetal red blood cells. It appears after the first 24 hours of life, typically peaking around day 3 to 5. It typically resolves on its own within 1 to 2 weeks, as the immature liver handles an increased amount of bilirubin. Now we will discuss pathological jaundice. This is a more severe type of jaundice that requires prompt medical attention. It is caused by an underlying disorder that prevents the liver from processing bilirubin correctly. Examples include blood type incompatibilities, like Rh or A/B/O incompatibility, infections, or genetic disorders. It often appears within the first 24 hours of life and requires diagnosis and treatment for the underlying cause. It persists for more than a week in term infants, or 2 weeks in preterm infants. So, to summarize, there are two types of jaundice: physiological jaundice and pathological jaundice. It appears after 24 hours of life, and it appears within 24 hours of life. It peaks at day 3rd to day 5th. It resolves by 1 to 2 weeks. It persists beyond 2 to 3 weeks. It consists of unconjugated bilirubin. It consists of conjugated or unconjugated bilirubin. Bilirubin rises at the rate of less than 5 mg per deciliters per day. Bilirubin rises at the rate of more than 5 mg per deciliters per day. Pathological jaundice requires urgent evaluation.